Enw fi di fewn a dwi'n gweithio ar y funud yn Meithrin Medra fatha rheolwr dros cyfnod mamolaeth. Chwerfo'r blwyddyn dwytha yn dirprwy rheolwr, a wedyn nes i, ath o'n cyfnod clo, wedyn nes i fynd yn rheolwr dros cyfnod mamolaeth tra oedd yr lwri yn gorau ynysu ac yn cael babi. So dwi'n teimlo bod fi wedi cael dim amser rili fatha dirprwy, ond dwi wedi cael amser fi wedyn jyst yn gorau sefyll i fyny fatha rheolwr, jyst i trial wneud o gyd mewn amser mor anodd hefyd. Achos bod fi'n fam fy hun, o'n i'n gwybod be oedd pob yn poeni am, o'n i'n gwybod mae pob eisiau neu siŵr bod plant nhw'n saff. 80 plant y diwrnod i lawr i 7, a wedyn nathon ni jyst gweithio efo'n gilydd i trio wneud yr rhieni teimlo fatha bod ni'n neud pob dim oedden ni'n medru. So wedyn nath yr rhieni ddechrau gweld be oedden ni'n neud a dechrau dod ar plant yn dol, a mae niferoedd ni wedi codi'n dol i fyny 80 y diwrnod rwan. Dwi'n neud hyn i plant fi, a dwi'n prawd o pa mor dda dwi wedi magu plant fi a bod fi wedi bod yna i plant fi a wedi dangos i nhw bod na ffordd o wneud pethau.
My name is Rachel Rowlands and I'm the Chief Executive at Age Connects Morgannwg. Age Connects is a registered charity that works across Rhondda Cynon Taf, Bridgend and Mae'r, and we support older people. My role predominantly is to make sure that we stay on track, that we are always focused on what older people want from us, need from us. We help around about 12,000 older people every year. We have a very different conversation with people when we talk to them. We are listening and then we're supporting them in whichever way they can. I think it's really important that we exist, that we give older people a voice, and our values as a charity are we listen, we learn, we care. You can't do this job unless you care. Even though I've been in this job for 16 years and I'm fairly well networked and I know lots of people, and you know, have sort of, I suppose, taken the charity to new places and achieved quite a lot in that time. The biggest barriers for me personally, I guess, is confidence. I do okay, I've just got to keep convincing myself that I do.
I'm Bernard Talabani. I'm a doctor specialising in kidney and transplant medicine. I'm also a scientist doing my PhD in immunology. I've taken to social media alongside my colleagues with Team Halo to try and make fun videos that give people accurate information on the COVID vaccines so they can make a decision for themselves. We started a group called Muslim Doctors Cymru. We started doing webinars in different languages, giving people an opportunity to ask their questions, but have it answered by someone who's from their own community in a language they're comfortable speaking, but also having a faith leader to give that side of the argument as well. We've helped to organise mosque vaccination centres, which have been a huge success. I was born in North Iraq in South Kurdistan. It was under Saddam Hussein's rule, and being Kurds, we were persecuted by Saddam Hussein. With everything that was going on, we were never really safe, and our future was really uncertain. When we were granted refugee status by the United Nations, we were allocated the UK as our new home, and so then we arrived here when I was 10. I am proud of what I've achieved. I've had family members, my parents in particular, sacrifice so much to give me opportunities I could have only ever dreamed of. I'm not extraordinary, I'm a very normal person, but I work really hard, and so if I can do what I want to do and achieve what I want to achieve, then there is no reason why nobody else or anybody else can't.
My name's Helen Lane. As a physician, I was working directly with patients who had COVID, who had been admitted to hospital, and also those who have other medical emergencies. I'd never written poems before, but I found it quite helpful. It allowed me to alleviate my mind. I found it quite cathartic, and it would help me to portray how I was feeling. One of the earliest that I wrote was called Not Again, and that was about the conversations that we had too often with relatives of loved ones who weren't going to make it. And we promised to be there to hold hands at the end of life, and we did. I had also written poems about the other healthcare workers, domestic staff, porter and staff, and it has a big effect on the catering staff. I'll never forget those conversations with people. I'll never forget some of those patients. I'll never forget holding the phones to people's mouths so that they could speak to their relatives, probably for the last time. And I think that bringing something positive out of it, to be able to help the staff and to be able to help us communicate with the rest of the world as to how severe the conditions have been for everybody involved is quite meaningful. So if I can help any of those to think that's how I feel when they see it in black and white, then it will be worth it.